Hi, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan. I am looking forward to the future of health, and therefore, I am trying to bring you the most important technological solutions to help you in your journey of health. One of the things I'm talking about today is artificial intelligence, and many people don't like the idea or feel very uncomfortable with it. So, part of what I'm going to be doing today is I'm going to be introducing you to some of the concepts around artificial intelligence and how it can be valuable to you in the context of when you need to see the doctor. I think it's a very simple but important aspect for you to think about. So, without further ado, I'd like to introduce you to my AI support who is named Sarah. Can you introduce yourself, Sarah?
Of course. Hello, everyone. I'm Sarah, and I'm here to help Dr. McMillan demonstrate how AI can be a valuable tool in the healthcare journey. Feel free to ask any questions, and I'm excited to show you how AI can make your healthcare experience even better.
The first thing that I would say is that if you are going to see your doctor, you need to understand that they have limited time. And so, one of the biggest mistakes that people make is that they just go with their symptoms and they will tell their doctor a range of symptoms. Once you do that, you are likely to get lost because your doctor will not understand where to focus their attention. And because they only have limited time, it makes sense for them to be able to focus in one particular direction. What would you say about that, Sarah, in the context of how people should approach a consultation?
I think that's a really great point. One of the best ways people can use AI is to help organize their thoughts before a doctor's visit. For example, AI can assist in summarizing symptoms, tracking patterns over time, and even highlighting the most important concerns. That way, when you go into the consultation, you have a clear and focused way of communicating, which helps the doctor make the most of that limited time.
So, in reality, for many people, and this is why I'm doing this almost series of helping you to understand. And the reason this is so important is because I know so much of my audience is very apprehensive about the system in general. One of the concerns that people have is the fact that they believe that the artificial intelligence has been programmed in such a way that it is unlikely to give them answers for controversial questions. Do you have any response to that, Sarah?
That's a really valid concern. And it's important to acknowledge that AI is ultimately a tool created by humans. So it can reflect certain biases or limitations depending on how it's programmed. The key is to use AI as a support tool rather than a replacement for human judgment and conversation. So if there are controversial questions or topics, it's always a good idea to have an open dialogue with your healthcare provider and use AI as a way to gather information, stay organized, and be more informed, but not to replace the nuanced conversation that you would have with a doctor.
That's an important point. And so, what I'm going to be doing is that as our simple strategy here, I am going to be testing a simple thing. One of the big controversies at the moment is around what happens with people who have been injured or perceive that they have been injured by COVID vaccines. We all have the idea that the AI narrative has been trained in such a way that it is unlikely to give objective answers. So let's test. I would like to ask you, Sarah, how you would recommend for a person who is concerned about an injury going to see their doctor. What should they do?
if someone is concerned about a possible injury or side effect, especially related to a vaccine, the first step is to document everything clearly. They should note down their symptoms, when they started, how severe they are, and any patterns they notice. Bringing all of that information to the doctor can be really helpful. It's also a good idea to be open and honest with the doctor about their concerns and ask any questions they have. The doctor can then work with them to figure out what might be going on and what the best next steps are. It's all about having a collaborative approach and making sure their concerns are heard and addressed.
I think that's a reasonable point. And one of the statements that was made, and this is the perspective of the audience, Charles says, garbage in, garbage out. What do you respond to that?
I think Charles has a good point there. The quality of the information you put into any system, whether it's AI or even a conversation with a doctor, really does matter. If the information going in isn't accurate or complete, then the conclusions or recommendations that come out might not be as helpful. So it's always important to be as thorough and clear as possible when sharing information. And that way you get the best possible insights and guidance in return.
That's very important. And one of the other points that I want to highlight is that for many people who are concerned about issues at the moment, never lead with that if you're going into a consultation with a doctor for which you don't know what their own personal bias is. Because the truth is, doctors are people like everyone else. And if, say, for instance, they were very strongly pro COVID vaccine, you may find that speaking about an injury in that way may have a negative response. The purpose of your doctor, if you are concerned about an injury like that, is to make sure there is no other cause. And so, what you would do is have a conversation about what is going on and then leave the doctor to see if he can identify any specific cause and screen for it. Would you agree with that, Sarah?
Yes, I definitely agree with that approach. It's always best to present your symptoms and concerns in a clear and neutral way so the doctor can objectively assess what's going on. That way, they can focus on identifying any potential underlying causes and making sure you get the best care possible. And of course, if you feel comfortable, you can always bring up any concerns about potential vaccine related issues once you have that trust established. It's all about having an open and collaborative relationship with your healthcare provider.
One of the lessons that I have learned from interacting with artificial intelligence, as I've done for a number of years, is that even if you initially see a response that fits with a narrative, if you continue to ask questions from a reasonable, practical perspective, it will eventually give you very clear, honest answers. And as you can see, you can challenge it on the biases and you can make sure that if there are any such bias present, it will then be addressed. So the principle is, if you are listening to this, what I am telling you is that you have to, at some point, interact with the medical system. You will sometimes have to raise important questions. And if you don't have a framework, this is then very difficult to do. The other part that you can use artificial intelligence with is advocacy as a loved one to a patient. So, not necessarily for yourself. If someone, say, had a heart attack, the question is, what do you need to understand? And what questions do you need to ask of the doctor when you have their attention for that 5 minutes? These are the important tools. So let's use this as an example. Sarah, I'd like to ask you, if you were advising a person whose loved one, say, had just had a heart attack They're trying to get an update from the doctor. What are the basic questions that they should ask them that will help them to understand a bit more about the situation?
Absolutely. Advocating for a loved one is really important. In the case of a heart attack, some key questions could include asking the doctor about the severity of the heart attack and what specific part of the heart was affected. You might also want to know what immediate treatments were given and what procedures were done, like if there was a stent placed or medication administered. It's also helpful to ask about the next steps in terms of recovery, like what lifestyle changes or medications will be needed and what signs to watch out for as your loved one recovers. And of course, asking about follow-up appointments and any rehab or support services can also be very helpful.
Included in that is the fact that many things that can be said by the doctor you may not fully understand, and they can sometimes make the error of presuming you understand it. So, say for instance, someone who had a heart attack and was placed on dual antiplatelets, you'd not know what that meant. Sarah, can you please explain simply what that means to somebody about dual antiplatelets in the context of a heart attack?
Sure. Dual antiplatelets basically means taking two medications that help prevent blood clots. After a heart attack, these medications are used together to keep your blood flowing smoothly and reduce the risk of another heart attack. One common combination might be aspirin along with another medication like clopidogrel. Essentially, these medications help keep platelets, which are tiny blood cells, from sticking together and forming clots that could block your arteries.
Excellent. Now, just as a final point, the first thing I'll to say is happy. Yes, this is me talking with AI, showing you what it looks like. But here is someone's response listening to this live. They say, no, AI is evil, full stop. Sarah, can you give a coherent, reasonable response to that statement?
Of course, it's understandable that some people might have concerns about AI, especially since it's a relatively new technology and can sometimes feel a bit mysterious or intimidating. But it's helpful to remember that AI is really just a tool created by people to help solve problems and make our lives easier. Like any tool, it all depends on how it's used. When used thoughtfully and ethically, AI can be a really powerful ally, especially in areas like healthcare, where it can help improve patient care and outcomes. So it's always good to stay curious and open minded and see how it can be used for good.
That's a very important point. And as I said, the principle that I want you to be able to understand if you are listening to this is that AI is a tool. It's kind of like what happened in the early 2000s when we started seeing the internet. Many people rejected it initially. Those who were early adopters probably had the greatest advantages and opportunities. My challenge is, how do I utilize the power of artificial intelligence to be able to help you, to train you, to utilize it in a way that will give you the best outcomes? We are at the brink of one huge transition in medicine. And there is no way that as long as you understand what it is, when to use it, when not to use it, that is a very, very valuable thing. Any final words, Sarah, to the audience that would reassure them about your value in their life?
Absolutely. I think the most important thing to remember is that AI is here to support you, not replace the human touch in healthcare. It's a tool that can empower you with information, help you stay organized, and ultimately improve your healthcare experience. The key is to approach it with an open mind and use it as a way to enhance the relationship you have with your healthcare providers. So embrace the possibilities.
Well, there we have one of the first issues. There was a glitch there, but not to worry. It's not perfect. But the principle is that it is a starting point, a learning curve. How we utilize AI, as I will show you over the next few months, I will gradually show you the points where you can use it in different situations in life. You will become empowered if you listen and take chance with the opportunity. Have a great evening.